Why are autism evaluation waitlists so long? Recent studies say that parents wait about 6 months to even 2 years until their child can be evaluated for autism, with about 40% of families being evaluated in 0 to 3 months and about 45% of families being evaluated anywhere between 4 to 11 months. My name is Dr. Soleil, and I'm a developmental psychologist who works in developmental behavioral pediatrics, and I specialize in neurodevelopmental evaluation. And the clinic that I'm in, our waitlists are about 4 months long. The biggest reason as to why the waitlists are so long is because diagnosing autism is a specialty skill. Most general pediatricians do not engage in autism evaluations because you need additional training and supervision to really know how to do it. As for psychologists, the demand for assessment or testing psychologists is super duper high, even outside of neurodevelopmental differences. For those of us who specialize in testing autism as psychologists, we've had to pursue additional advanced training, for example, being trained in specific measures, as well as completing postdoctoral fellowships to say that we can do this legitimately. Aside from the shortages of the specialists who actually do the autism evaluations, another thing to consider is the length of the appointments. Autism appointment evaluations can range between 2 to even 6 hours, sometimes even 10 hours, depending on how complex the present needs or concerns are. And after the testing is done, the providers have to write up those reports, and they can be pretty lengthy. So we have to talk about their performance on specific tests, the actual eligibility, developmental differences and strengths, as well as tailored recommendations. Those documentation burdens are very high and take up a lot of time. And I personally work in a 100% evaluation role where I'm constantly doing evaluations and turning them around pretty quickly. Specifically, I do about 2 evaluations per day. Due to long wait lists, some families, if it's in their means, opt into private evaluations, but that can be pretty costly. In California, I've heard of some autism evaluations ranging between $3,000 to $6,000 out of pocket. If you're a parent of a child who's autistic, how long did you have to wait for them to be evaluated? Or if you're a provider, how long are your wait lists? I've made this online space for other folks who are interested in becoming autism or neurodevelopmental evaluators. So if you have questions on this career, comment below.